Good morning. I'm Michael Schutz from the Office of Sponsored Research. Welcome to Immaculata University's Undergraduate Research Symposium, Posters Under the Dome, celebrating our students and faculty. During this virtual event, students present highlights of their research performed in collaboration with their faculty mentors. Please refer to the IU Research Symposium program for a listing of all the student presentations. Within the program, links to Google Meet rooms are provided and arranged by undergraduate academic departments. You may move from room to room to listen to different presentations. A moderator will now share the student poster presentations and allow for a brief question and answer period following each presentation. Thank you for supporting our students and our faculty. We hope that you enjoy this wonderful student event.
This is Brianna Dyer and Caitlin Adams. Today we will be discussing the effectiveness of high-flow nasal cannula oxygen on NICU patients. High-flow nasal cannula therapy has been utilized within the NICU setting in an effort to reduce invasive treatment modalities such as mechanical ventilation, which can often be difficult to wean patients back off of. The goal of our literature review is to determine whether or not this treatment method is an effective replacement for mechanical ventilation within the NICU population. Our works of literature were retrieved via healthcare-driven databases such as Ovid and CINAHL. The publications were obtained by searching for keywords such as high-flow nasal cannula, NICU, neonatal intensive care unit, and non-invasive therapy. Quantitative and qualitative studies conducted by peer-reviewed journals were what we were searching for. However, due to a lack of recent research on this topic, the vast majority of our evidence has come by means of published literature reviews. According to the literature that we did find, high-flow nasal cannula therapy has been proven beneficial as an alternative non-invasive therapy. When compared to CPAP therapy, it is not as effective within the premature population with advanced respiratory distress. Overall, high-flow nasal cannula usage promotes patient comfort, parent-child bonding, while eliminating excessive nasal trauma and the difficult setup by healthcare personnel.
While we were not able to find any research that outright said the effectiveness of high-flow nasal cannula therapy, based off of the articles that we did find, we found that there was frequent use of high-flow nasal cannula usage amongst neonatologists and neonatal nurse practitioners throughout the United States, along with research about high-flow nasal cannula weaning procedures. We concluded that high-flow nasal cannula proves to be an effective respiratory therapy for NICU patients. There is minimal research established regarding high-flow nasal cannula use in the NICU, and so for further research, we could include guidelines for flow rates correlating to gestational age, as well as standardization across the United States for consistency and dependability in use of high-flow nasal cannula therapy.
This is the critical care nurse's role in preventing ventilator-associated pneumonia. I'm Larissa Wilkins, and this is Luz Zamora Campos. Our facility sponsors are Dr. Alorip and Dr. Adedokun. A literature review was conducted to evaluate how critical care nurses can contribute to the prevention of ventilator-associated pneumonia. Ventilator-associated pneumonia, or VAP, is one of the most common hospital-acquired infections with a high mortality rate. It usually occurs 48 hours after mechanical ventilation. Most patients that need mechanical ventilation are admitted to critical care units. Critical care nurses play a vital role when it comes to preventing ventilator-associated pneumonia. The critical care nurse can help prevent ventilator-associated pneumonia by performing abdominal massages, implementing the ventilator bundle, and completing continuing education credits. In our research, there was a couple of methods that were used. The first was a qualitative research approach with a comparative descriptive design to assess the competency of ICU nurses in using ventilator-associated pneumonia bundle. The second article research study, along with other researchers, conducted a prospective intervention study to evaluate the use of the ventilator bundle and staff education to decrease ventilator-associated pneumonia in intensive care patients. And this was evaluated in 3 phases. Last, a 15-minute abdominal massage was administered to the patients in the intervention group twice daily, and no intervention was administered to the patients in a control group. Then there were researchers completed a questionnaire and asked about the patient's information, enteral feeding traits, and the development of VAP.
The studies shared similar results and they were all positive. All of the results showed a decrease in ventilator-associated pneumonia. The results of the first study proved that ICU nurses using the VAP bundle to prevent VAP was influenced by knowledge in private hospitals. For the second study, during the baseline phase, the VAP rate was 21.6 per 1,000 ventilator days. However, the results showed a decrease in VAP during the post-intervention phase. The rate of VAP decreased to 11.6 per 1,000 ventilator days. The final results of the study showed that the amount of gastric residual volume and abdominal circumference measurement of patients in the intervention group had decreased. These results were significant because they contributed to a decrease in ventilator-associated pneumonia in the intervention group with a ratio of 6.3% compared to the control group. The researchers from the first study found that the use of the ventilator-associated bundle by ICU nurses was used more in private hospitals than in government hospitals. The second study concluded that nurses using the ventilator bundle and improving their knowledge about it decreases both the incidence of VAP and the length of stay on the unit. The final study showed that administering abdominal massage to intubated and internally fed patients leads to a decrease in ventilator-associated pneumonia. After the studies were completed, the researchers gave recommendations for further research. They recommended that an exploratory study can be done to determine what factors are responsible for the contribution of ventilator-associated pneumonia. Another research suggested that a comparative study can be conducted to identify differences in knowledge of the VAP bundle between postgraduate students of medical and surgical nursing and undergraduate staff nurses. And these are our references.
Our poster is on optimizing effects of cardiac rehabilitation programs. I'm Laura Damasco, and this is Emily Cosgrove. Our faculty sponsors are Dr. Carol Lorup and Dr. Charity Adedokin. Introduction. Cardiac rehabilitation, CR, programs aim to reduce fatality among patients who have experienced previous cardiovascular events. Cardiac rehab programs have a variety of implementation styles, and there is no standardized treatment plan. An interdisciplinary team works with patients throughout the cardiac rehabilitation process to monitor progress and evaluate needs. The goal of our literature review was to assess previously conducted studies that addressed our research question, which is, does the incorporation of nurse involvement, structured clinical pathways, and patient screenings in cardiac rehabilitation programs influence outcomes in patients who have cardiovascular disease compared with traditional programs?
Methods. Studies address patients with known cardiac disease enrolled in cardiac rehab programs. In one study, a CR program utilized an updated clinical pathway and observed 199 patients to monitor and track their participation, engagement, and compliance to the updated program. The updated clinical pathway included a liaison nurse in patient care and added in-home CR programs. Another study included 109 patients who completed interviews with nurses, depression scales, anxiety inventories, and caring assessments to determine how mental health affected program compliance. The last study observed 217 patients over a 14-month period in a nurse-led CR program. They had routine cholesterol and blood pressure monitoring to determine effectiveness of the program.
Results. Updated clinical pathways decreased program wait time, number of hospital visits, and increased compliance rates. The nurse liaison provided education that improved smoking cessation, medication compliance, dietary changes, and family engagement. Nurse-led programs showed an increase in smoking cessation and a decrease in LDL cholesterol and systolic blood pressure compared to traditional programs. Mental health screenings and nurse interviews identified depression as the main influencer in decreased participation and adherence to a CR program. The caring assessments identified that nurses treating patients kindly and listening to them enhances the nurse patient relationship and promotes engagement in CR programs.
Conclusions. The literature review provided insight into the importance of cardiac rehabilitation programs and the need for patient compliance and engagement in reducing future cardiac events. For optimal patient success in cardiac rehab, programs should include mental health screenings, increased nurse involvement, and a structured and uniform clinical pathway. Cardiac rehab as a tertiary prevention strategy in all patients following cardiac related hospitalizations provides for optimal patient monitoring and disease management.
Further research. A sample including patients from various cardiac rehabilitation programs may help to better understand the influence of clinical decisions on patient outcomes. Quantitative research studies that collect laboratory and functional assessment data at scheduled intervals throughout participation can provide information on the amount of time that patients should be enrolled to achieve maximum benefit. Also, experimental studies can be done to assess patients' reasons for withdrawal from cardiac rehab programs and strategies to prevent this occurrence. Here are our references.
This is our poster titled Pain in Pregnancy. I'm Joanna and this is Michaela. Pain in pregnancy is an area of concern in nursing practice due to the discomfort associated with birthing a child. The trauma associated with childbirth has a lasting effect on women. There is a lack of research associated with the pharmacological and non-pharmacological pain relief methods during pregnancy and childbirth. However, there are many different measures that can be taken to relieve the chronic pain women experience due to pregnancy. The most common area women experience pain is in their back. Non-pharmacological methods such as acupuncture and yoga have shown significant effects on decreasing pain experienced during pregnancy. Methods. While conducting this literature review, the database used was CINAHL, which is located on the Immaculata Gabriel Library server. Keywords used in the search engine were pain during pregnancy, chronic pain in pregnancy, pain related to pregnancy, back pain in pregnancy, back pain during pregnancy. Articles used were dated 2016 or earlier for relevance purposes. Data collected consisted of peer-reviewed nursing articles and journals. Many of the articles discussed different types of studies or experiments done. For example, quasi-experiment and multinational studies were used. Results. The article titled Nursing and Advanced Acupuncture for Relief of Low Back Pain During Pregnancy used a quasi-experimental style. The article examined 6 pregnant women at gestational ages varying between 14 and 37 weeks who complained of low back pain. 6 acupuncture sessions were performed twice a week, lasting 30 minutes each. The study used the visual analog scale to assess pain. The goal was to see the different effects that acupuncture had on low back pain in women in their second or third trimester of pregnancy. The study showed a reduction in pain index scores among the participants. For some women, pain ceased before completing 6 sessions, and there was improvement in the pain experienced during their day-to-day activities. Acupuncture provided beneficial effects for the health of participants because their pain reduced after the second session. The article titled Yoga for Moms discussed a research study that piloted a midwife leading a prenatal yoga program to complement standard prenatal care. Yoga was studied as another option to alleviate the struggles of childbirth. During the study, yoga was taught by midwives and ran weekly over 8 sessions. The participants were women 20 to 38 weeks of gestation. They collected data in diaries, which was analyzed with a descriptive content analysis. Results found yoga classes were successful in reducing maternal anxiety and equipping women with simple ways of managing pain experienced during pregnancy, labor, and childbirth. The article titled The Severity and Impact of Pelvic Girdle Pain and Low Back Pain in Pregnancy conducted a cross-sectional self-reported questionnaire study of pregnant women in gestational weeks 30 to 38. Results found impact on well-being and health reports that some women were satisfied with their pain relief method. Medication was associated with negative feedback, whereas women that were taught relaxation techniques often continued to use these methods with beneficial outcomes.
Conclusions. Women experience pain during pregnancy, and there are a variety of ways to treat it. Research and data suggest that there are better approaches in treating pain. Hospitals and birthing centers commonly resort to pharmacological interventions for pain relief in both pregnant and non-pregnant patients. Non-pharmacological interventions are effective and a safer option for both the mother and the baby. There are various side effects to pharmacological pain relief methods commonly used during pregnancy. There are minimal side effects to non-pharmacological pain relief methods. Further research. There was a lack of research regarding pharmacological interventions used in pregnancy in the United States. This put a limit on the data that was collected. There was also a lack of research regarding the different cultural perspectives and their varying perceptions of pain in pregnancy. Further research would be needed to examine these aspects and continue to improve the treatment of pain in women during pregnancy. Our references are listed below, and we would like to give a special thanks to Dr. Adedokun, Dr. Larup, Michael Schutz, and Leah Bustrain.
The title of our poster is The Effects of Alarm Fatigue on Nursing Practice and Patient Safety. My name is Samantha Haddad, and this is Laura Giordano. Our mentors include Dr. Larup and Dr. Adedokun. Introduction. The goal of our literature review was to evaluate previously conducted studies that address our research question, what are the best methods to increase patient safety and prevent alarm fatigue in critical care nurses? The populations in the studies include pediatric and adult ICU nurses of both the female and male gender. Alarm fatigue occurs when clinicians are exposed to a disproportionate number of alarms, resulting in desensitization of alarm sounds as well as an increased rate of missed alarms. Alarms that are intended to warn clinicians of issues with patients are often overlooked due to the large number of false alarms. Assuming an alarm is incorrect puts the patient at danger and can result in medical errors. Alarm fatigue is a major safety concern because often nurses turn down the volume of these alarms, ignore the alarms, and even adjust the settings, which puts the patient's safety at risk. Methods. The studies analyzed include a risk assessment of alarm fatigue, an integrative review measuring alarm accuracy and clinical relevance, a cross-sectional survey determining critical care nurses' knowledge of alarm fatigue and practices towards alarms in critical care settings, CINAHL, which was the database we used to look up the research. The keywords we used for our search included alarm fatigue interventions, patient safety, and critical care. The studies that were analyzed date back to 2013. The methodology consisted of an integrative review method described by Whitmore and Knopf, the Health Technology Foundation 2011 Clinical Alarm Survey, and a standardized observation form by the researcher.
Most of the studies that we analyzed showed that alarm fatigue was discovered in nurses who were exposed to a high frequency of both false and nuisance alarms. These nurses also exhibited delayed response times to other alarms. Data showed that 84% of nurses claimed they were aware of the causes of alarm fatigue. However, when their experience was probed further, 52% actually claimed that they were unsure of how to avoid the susceptibility to the fatigue. A total of 62% of nurses agreed that background noise did interfere with alarm identification, and 50% agreed that the multiple sounding devices throughout a shift caused confusion when it came to identifying specific critical alarms. The number one barrier to successful alarm management was found to be the occurrence of false alarms, which led to a decrease in focus and clinical response times. Smart alarm technology, which employs several parameters and alarm algorithms, was found to be effective in minimizing the number of false alarms. Further education about how to avoid alarm-related adverse effects is pertinent, and it should be further incorporated in the clinical care setting. Other interventions included intelligent alarm algorithms or alarm settings that are customizable by nurses themselves. The conclusions of this study showed that factors such as false alarms, technical alarms, inadequate warning limits and settings, as well as overuse of physiological monitoring were all found to be indicators of alarm fatigue. The risk assessment study determined that nurses were at an extremely high risk for developing alarm fatigue. This also has significant implications for inhibiting patient safety and can cause adverse outcomes that may result in patient injury or even death. Excessive alarms can also lead to error, and nurses responding to many non-actionable alarms also depletes the quality of nursing services. Research suggests that custom alarm settings, smart alarm technology, and education regarding alarm fatigue could help decrease the issue, but more research is needed. In further research, several recommendations were made from the studies that we analyzed, and some of these included creating a task force to manage alarm fatigue and the surrounding issues. Manufacturers could potentially create safeguards to reduce unnecessary alarm sounds, and further education to better understand medical alarm equipment as well as the concept of alarm fatigue could also be used. Further research on possible interventions was recommended due to the lack of experimental studies available today. And education should be focusing on identifying the levels of alarm fatigue among critical care nurses and evaluating the training approaches to managing alarm fatigue. Nurses should be the leading efforts to this issue to assure that patient safety is always addressed and this patient safety issue is decreased among healthcare organizations worldwide. And this is a list of our references right here. And we would like to also say thank you to our professors, both Dr. Lorup and Dr. Adedokin, as well as Michael Schutz and Lee Bustron for all of your support and guidance throughout our project. Thank you.
Metabolic Syndrome Among Night Shift Nurses by Caitlin Huntsberger and Jennifer Henry. The goal of our literature review was to assess previously conducted studies that addressed our research question, which is, in what way does metabolic syndrome affect night shift nurses greater than day shift? Our purpose was to assess the prevalence of metabolic syndrome among night shift nurses. The 5 conditions that lead to a metabolic syndrome diagnosis are central obesity, high triglycerides, low HDLs, hypertension, and a high fasting blood glucose. The population included in the studies were nurses, both male and female, and primarily night shift nurses, although day shift nurses were included. Variables that were studied were the prevalence of metabolic syndrome among night shift nurses and risk factors that lead to metabolic syndrome. The study was developed to target night shift nurses and their likelihood of developing metabolic syndrome. In our first reference, excess metabolic syndrome risks among women health workers compared to men, there were 256 participants, and they used the International Diabetic Federation criteria as their parameter. In our second reference, burnout and metabolic syndrome in female nurses, they had 171 participants. They assessed age, shift, area of service, and education level. And while they also used the International Diabetic Federation criteria, they also used the Maslach burnout inventory as their parameter as well. In our third reference, sleep duration as a mediator, there were 294 participants. For their parameters, they used a detailed questionnaire to collect information on sociodemographic factors, lifestyle, and working patterns. They also assessed activity using Global Physical Activity Questionnaire. All studies assessed waist circumference, triglycerides, high-density lipoproteins, blood pressure, and blood glucose. The purpose of the study was to discover whether there is an increased risk for metabolic syndrome among nurses that work primarily in night shift. For the results of our first reference, 1/3 of the women healthcare workers were at a higher risk for metabolic syndrome compared to under 10% of men that were at a higher risk for metabolic syndrome. For reference, in the entire study, there was 172 women that participated compared to 84 men. A second would be women had a higher frequency of actually being diagnosed with metabolic syndrome than to men. For reference, that's 34.9% to 2.4%. For a second reference, no association was found between burnout and metabolic syndrome, although there was an association between emotional exhaustion, personal accomplishment, or night shift versus increase or decrease waist circumference. In our third reference, night shift workers have a fewer lifestyle accommodations than day shift workers. Minimal difference was noted between waist circumference and blood pressure between the shifts, but there was a greater difference in elevated triglycerides, blood glucose, metabolic syndrome, and sleep duration. In conclusion, for our first reference, a higher prevalence of metabolic syndrome in female nurses than males was noted. In our second reference, no association between burnout and metabolic syndrome were noted. However, if there was a higher emotional exhaustion, they had a greater risk for waist circumference increase. But if there was a higher personal accomplishment, they had a lower waist circumference risk. In our third reference, the conclusion was reduced sleep duration in female shift workers is a pathway to increase risk for metabolic syndrome. Metabolic syndrome can lead to problems in the heart, mentally, or metabolic health. Metabolic syndrome can also increase waist circumference, elevate blood pressure, elevate blood glucose and cholesterol levels, and also lead to exhaustion. For further research, comparing healthcare to non-healthcare shift workers is something that would need to be seen. We would also like to see a wider number of participants and also to maintain a minimum gap between participants, whether it's age-related, shifts worked, or male to female. Whereas if they were both in the hundreds or both in the 80s. And then finally, we would like to conduct a study regarding longer time exposure, following participants for longer than the initial survey to see if time spent in the shift affects the outcomes of metabolic syndrome. And these are our references.
Nursing is in high demand as a profession and has greatly evolved over the years. Nurses in emergency department experience physical, mental, and emotional challenges. The emergency department is one of the top stressful working environments. Stress reduction and coping techniques have been effective in reducing stress and burnout. Key words to use were nurse and emergency department, burnout and nurses, nurse and stress, and nurse burnout and emergency department. Ovid database yield 12,848 articles. The articles were within 5 years. Our study includes both quantitative and qualitative research designs. We included articles from American and British journals.
Nurse staff retention was found to be linked to organizational empowerment. Many emergency department nurses reported burnout due to patient situations such as gunshot wound victims and rape victims. Burnout is also due to inadequate staffing or incompetent assistants, such as certified nursing assistants. Email reminders suggested for improving stress management. Maladaptive coping techniques also lead to nurse burnout. Emergency department nurses who use adaptive coping techniques are equipped to handle difficult situations. Improved personal and professional relationships are seen. Adequate patient care can be given. Ill preparation for stressful situations can lead to inaccurate treatments for the patient. Research should be conducted to better indicate how empowerment classes can aid in the practicing nurse. Exploration in additional variables such as culture, attitude, and beliefs be considered to enable in-depth understanding. Additional research is advised to identify the ideal timing of stress management and resiliency training programs. Investigation on the best ways to integrate program concepts into practice is helpful for nurse educators. Developing programs for stress burnout should be applied during nursing school to determine if graduate nurses are better equipped to combat nurse burnout. On the side is our references. Thank you so much for watching and have a great day.
Hello, my name is Aminata Carbo. My partner is Mamaya Donzel. Our topic is preventing medication errors by new nurses. Our faculty mentors are Dr. Carol Laurup and Dr. Charity Adedokun. Introduction. Safe medication administration is an essential component of quality care in nursing. Medication administration is one of the highest risk areas in nursing, and errors are reported to occur in 1 of every 5 medication dosages. Medication errors are considered human errors that are thought to arise from knowledge deficit, lack of experience, and poor prioritization, which are usually evident in new graduate nurses. Medication errors include calculating the wrong dose of a medication, administering the wrong medication, administering a medication at the wrong time or via the wrong route, and administering the wrong medication to the wrong patient. These are known as the 5 rights of medication. We have a graph here that shows the percentages of medication errors and how they occur, with wrong time being the highest medication error. Methods. Our research showed that one study consisted of new RNs with less than 1 year of nursing experience. The participants were recruited from 2 residency cohorts throughout a large healthcare system in the Midwest United States. A total of 54 new RNs participated in the study. There were 25 participants in the control group and 29 participants in the intervention group. Another study used a descriptive mixed method approach employing both qualitative and quantitative items. Data were collected using a survey that was distributed in February of 2015 to graduates of a large state-sponsored Bachelor of Science in Nursing program in the southeastern United States. A third study used a non-experimental survey design known as a medication administration practice survey and was developed for use during this study. The survey was designed to include questions based on medication administration practices and not solely on medication errors. Results. The top 3 reasons why new RNs think medication errors occur are interruptions during medication administration, communication errors during medication administration, and inadequate staffing levels in nursing units. The top 3 reasons why new RNs are not reporting medication errors include fear of retribution, believing others will think they are incompetent, and not realizing an error occurred. Inadequate knowledge and skills and a failure to comply with hospital policy were also identified as causes of medication errors, especially in new graduate nurses.
Conclusion. Survey research has shown that medication error by new grad nurse usually result from inexperience, rushing, technology, staffing, and patient acuity. It is essential to stress the importance of best practice, such as independent double check for high-risk medication, managing care effectively, and advocating for safety in clinical environment. It was also recommended that medication administration education is provided early in the new graduate nurse orientation and in residency programs, including specific discussion on safe dose range and clarification of what actually constitute a medication error. Graduate nurses would need skills for handling the aftermath of making medication error. Successful helping them navigate the experience would be an important contributing to nursing education. Further research. Further research also needs to be done to determine how effective simulation is for new RNs, identify other gaps in medication administration knowledge, and see how a medication administration simulation will affect medication error in practice among new RNs over the time. Additional research is needed to be done to determine what factors is addition to the 5 rights are useful for nurses to follow when administering medications.
Further research is needed to determine whether a BSN
Okay, so the topic that we will be presenting today is pediatric pain management. My name is Danielle Kerr, and I'm working with Allison Zimney, and our nursing research faculty are Dr. Lorup and Dr. Adedokun. So to start off, our research question that we are asking is, what are the benefits of pharmacological methods versus non-pharmacological interventions when managing pain in the pediatric population? And the biggest barrier to this is that pediatric patients are sometimes unable to express their level of pain or describe their pain due to, being too young or maybe being nonverbal. And therefore, it is up to the nurse to interpret and determine their level of pain and then to advocate for proper treatment of that. And the key to effective pain management and improving patient care and patient outcomes is for the nurse to perform an initial assessment, apply interventions, and then reassess. And so for our methods, we have our pharmacological methods, which are just prescribed medications like oral and IV meds. And the most common ones for pain are analgesics, sedatives, steroids, and benzodiazepines. And then non-pharmacological methods, there are, the possibilities are endless for this, but just some are music, art, and pet therapy, guided imagery, distraction, heat and ice therapy, and then oral sucrose and swaddling for infants. And we measure our pain through different pain scales. So we have a numerical rating, the FLAC pain scale, the Wong-Baker Faces scale, and the neonatal infant pain scale. And I've included a picture of the FLAC pain scale, which measures face, legs, activity, cry, and consolability. And then for the results of the studies that we looked at, it was found that pediatric patients who were given both pharmacological and non-pharmacological treatment had better managed pain than those who were only treated pharmacologically. So in one study titled Mother's Experiences of a Touch and Talking Nursing Intervention to Optimize Pain Management in the PICU, is from the Journal of Intensive and Critical Care Nursing. And the goal of this study was to see how parental involvement impacted the child during an invasive procedure. And the results showed how important it is to use non-pharmacological measures and provide comfort for the critically ill child. And then in another study titled Nurses Under Use of Non-Pharmacological Pain Relief and Interventions in Preterm Infants is from the Journal of Nursing Children and Young People. And in a NICU, it was found that nurses were really underusing different types of non-pharmacological interventions due to the absence of pain guidelines, the quality of each nurse's training and education, and the low age of patients and them not being able to express their pain. Therefore, implementing more of these guidelines would ensure that non-pharmacological measures are being used and the nurses making sure to keep up on current evidence-based practice so that they can update their knowledge on different forms of pain management.
So in conclusion, we found that combining both pharmacological and non-pharmacological pain management methods is the best, most effective way to treat pain in the pediatric population. Adding non-pharmacological interventions, including but not limited to heat, ice, swaddling, and music therapy to the treatment plan of a pediatric patient allows for sufficient pain control and the need for less pharmacological interventions. In order to manage pediatric pain effectively, understanding and using pain scales correctly is imperative. Some further research topics that we found are needed for us to fully understand pediatric pain management includes knowledge of the long-term effects of prescribed medications on the pediatric patient and the long-term effects of untreated pain. It is important for nurses to know the best pain management strategies, whether it is pharmacological or non-pharmacological. Research based around implementing pain management guidelines and policies is extremely important to prevent medication errors, to then prevent the potential overuse of pain medication that can lead to long-term damage or fatalities. One last aspect of pediatric pain management that we put as needing to do further research on is the parental or caregiver involvement overall in comforting the child during painful procedures.
Hi, my name is Amanda Mitchell, and I am a senior nursing student. My poster addresses the management of adolescent bereavement. I conducted a literature review to assess previously conducted studies to address my research question. In bereaved adolescents, does grief therapy decrease the risk of developing psychosocial morbidities? My search demonstrated no known evidence from nursing research and instead stemmed mainly from psychiatric and family study journals. The 3 empirical sources used in my research included the use of male and female adolescent populations. It also analyzed the prevalence of maladaptive grief reactions, psychosocial morbidities such as depression, anxiety, post-traumatic stress reactions, substance abuse, and suicidal ideations, as well as the effectiveness of therapeutic interventions. The methods used throughout my research determined the relationship between adolescent bereavement and grief therapy. Most often, phase-based therapy sessions were utilized weekly. To determine their effectiveness, assessments and screenings were done. PTSD assessments, depression and anxiety assessments, as well as bereavement assessments determined the overall effectiveness using a Likert scale. The results showed that adolescent bereavement has been shown to contribute to psychosocial morbidities as previously mentioned, including depression, anxiety, post-traumatic stress reactions, substance abuse, and suicidal ideations. Grief therapy has been proven successful in decreasing maladaptive grief reactions. Protective factors such as supportive family, peers, and a sense of belonging in the community can lead to a normal grief progression in adolescents. In conclusion, the literature conducted provided insight to the role of bereavement on the psychosocial development of adolescents. Grief therapy has been proven to be a successful intervention in the grief process. However, further research is currently needed in the field of nursing as there is currently no known evidence. A well-developed method in grief therapy is the use of multidimensional grief therapy. However, this was a pilot study that was being conducted, so the use of a control group to better understand the statistical significance of improvements would be required.
Non-Pharmacological Methods for Musculoskeletal Pain Relief by Samantha Moyer and Adam Snyder. The purpose of this research collection was to determine the efficacy of non-pharmacological musculoskeletal pain relief. Musculoskeletal pain is believed to affect more than 1 in every 2 individuals. The incidence rate of musculoskeletal pain is believed to be over 75% in adults over 65. Long before modern medicine developed pharmaceutical pain relief, there were options like heat therapy, massage, aromatherapy, and hypnotherapy to relieve pain. However, the standard treatment for pain has widely changed to pharmaceuticals. Since the opioid epidemic's recognition, it has become a topic of conversation to steer away from narcotic pain relief. In 2019, 9.7 million people admittedly misused prescription pain relievers. This statistic alone is startling enough to push the nursing community to look back towards the use of alternative treatments for musculoskeletal pain relief. This research study collected data from multiple sources. Each information source maintained the use of assessment survey methods to collect data on the effectiveness of alternative treatments for pain relief. Patients suffering from musculoskeletal pain were surveyed before they began treatment, after the completion of each treatment session, and again at the end of their prescribed time length of therapy. Differing studies had different objectives and variables. One study identified the effectiveness of massage on musculoskeletal pain by removing the use of pharmaceutical pain relief entirely. Another focused on the effectiveness of hypnotherapy in conjunction with continued pharmaceutical pain management. A third included the use of music therapy and aromatherapy on critically ill patients with severe pain in combination with their prescribed medications.
The review of literature showed that in some cases, one or more alternatives like massage, hypnotherapy, aromatherapy, or music therapy reduced the pain experienced by the patients. Moreover, the methods of non-pharmacological pain management were more effective in reducing acute or chronic pain when used in combination with prescribed pain relievers. While one study suggested that non-pharmacological methods of pain relief may not be beneficial to clients in critical care, another study recommended that the use of over-the-counter medications for pain relief combined with alternative therapies caused pain reduction in chronic patients and prevented the need for stronger prescription medications. Overall, therapies including but not limited to heat therapy, aromatherapy, music therapy, and massage therapy all showed positive benefits in pain management. This study reviewed literature analyzing the effectiveness of non-pharmacological methods of pain relief and how they compare to using analgesic medications. Some of the studies reviewed showed little to no significance in pain relief using non-pharmacological methods, especially in the critical care setting. However, a majority of the research showed significant benefits to using these non-pharmacological methods to treat pain. The review concluded that using non-pharmacological methods alongside analgesic medications is the most effective method of pain management.
The facts of this study are that there is much more room for further research to be done on the use of non-pharmaceutical pain relief for musculoskeletal pain. This review only focused on 4 specific alternative therapies: massage, hypnotherapy, aromatherapy, and music therapy. However, there are countless other options that little or no research has been done on. Aside from many other therapies, research could develop into the types of patients most benefited by each therapy and which therapies work best with or without pharmaceutical combinations. The future of alternative pain relief methods rests in the hands of the nurses who want to continue to develop holistic approaches and better outcomes for their patients.
Hi, my name is Lynn Krieger. Hi, I'm Noelle Paraguay. Our project is Nurses Coping Strategies for End-of-Life Care, and our faculty mentors are Dr. Charity Adedokun and Dr. Carol Lorup. Nurses care for patients at the end of life, which can be extremely difficult. Therefore, nurses need support. However, currently, nurses do not have enough support, which can lead to negative consequences like compassion fatigue. The research question was, in nurses caring for patients at the end of life, what strategies are used to effectively cope with the emotional stress of caring for end-of-life patients compared to defense mechanisms in increasing the emotional health of these nurses? Research focused on identifying the effects of ineffective and effective coping strategies for nurses caring for patients at the end of life and specific interventions and implications for further research in this area. The literature review was conducted using the keywords end-of-life, coping strategies, defense mechanisms, and nurses. The databases used to search the literature were EBSCOhost, CINAHL, and ProQuest Public Health. Literature was evaluated for empirical evidence and design, then analyzed and synthesized to develop conclusions. Results showed that nurses need support to combat compassion fatigue, including self-care strategies and maintenance of professional boundaries. Nurses also need organizational support in combating compassion fatigue and other negative consequences of professional grief. One study found that nurses are not being provided education about the grief that they will experience when providing end-of-life care to their patients. Another study found that support is not being provided for patients, families, and nurses. The last study found that mature defense mechanisms can be used and they help decrease depression and anxiety in nurses. In conclusion, nurses need effective coping mechanisms to prevent compassion fatigue before it happens. While defense mechanisms can be helpful, they cannot help prevent compassion fatigue. Future research could be done into the effectiveness of different types of coping strategies and defense mechanisms. Research could be done on the differences in compassion fatigue on different patient care units. Each article only looked at one type of patient care. However, looking at multiple types of patient care units would provide a more detailed report of compassion fatigue for nursing as a whole. More research could also be used to discover what educational materials can be used for training and orientation of nursing students and licensed nurses on compassion fatigue, and our references are included.
Hello, the title of our evidence-based research project is titled Environmental Modifications to Improve Sleep in Hospitalized Patients. Our topic is about how most hospitalized patients are faced with interruptions in their sleep with continuous need for assessments and monitoring. So for our research, we will focus on some environmental modifications that can be implemented to decrease patient anxiety, increase comfort, and support and recovery.
Hello, my name is Abu Sise. Yeah, I'm gonna explain the methods and the result of our study regarding the environmental modifications to improve sleep in hospitalized patients. Um, okay, so to do this study, we reviewed various studies regarding interventions, various articles regarding interventions that improve sleep in hospitalized patients. Um, Four peer-reviewed articles were reviewed to get an insight into some of the interventions that improve sleep. In one of our reviewed articles, prospective cross-sectional study was completed in 15 clinical areas over a 6 month period. The studies involved observing the nocturnal environment, patient interviews, and various nursing reports and questionnaires were completed. Another article um, also used an exploratory cross-sectional study design, utilizing in-depth, semi-structured focus groups, and qualitative discussion was also used. Um, in doing this, surveys were given to a certain number of nurses that they complete and submit to the surveyors. The third was a descriptive study in an ICU involving 900 patients over a 5 month period, while the fourth article used an exploratory cross-sectional survey design um, to determine nurse and patient perceptions of sleep disturbance and the impact of nursing interventions, including trialing a headband. Um, in this study, uh, both nurses and patients did agree that sleep is a problem for patients. However, they totally disagree on the number and the methods to control these sleep issues that pervades hospitalized patient. For the results section, article one in article one, the patient reported a mean reduction in hospital sleep when patients were asked to determine whether being in the hospital impact their sleep. They reported a mean reduction of about 1.8 hours compared to home. When asked to rate their sleep quality, 41% rated it poor or very poor, 34.2% as fear, and 24.2% as good. Environmental noises and clinical care interventions are reported as the main reasons for poor sleep by both patients, nurses, and observers. Noise levels in all 15 clinical areas exceeded the WHO allowed limit. Nurses identified four major types of influence on sleep for children and their parents. These include child factors, um, child factors, environmental factors, nurse-parent interaction factors, and nursing care factors. Many of these factors were amenable to intervention. Balancing strategies to preserve sleep with the provision of nursing assessment and intervention was challenging and complicated by the difficult nature of work outside of usual waking hours. Both nurses and patients perceived both nurses and patients perceived the most effective interruption of sleep nurses avoiding interrupting sleep for assessment, care, and pharmacological interventions. To help accomplish this, nurses use aids such as the airband, sleep medications, and clustering tasks.
So, in conclusion, adequate sleep is critical for patient recovery and recuperation. There are major variations between nursing and professionals and family perception in healthcare settings. Care interventions may significantly affect the sleep of patients in intensive care unit. The condition of hospitalized affects of the patient's quality of sleep. And then for further research, do people have similar sleep cycles? How can nurses enhance patient sleep? Is it safe for children to take melatonin every night? And lastly, can interprofessional collaboration improve patient sleep?
Shift Work and Nurses' Physical and Psychological Well-Being by Matt Delalo and Ian Wiegand, supported by Dr. Lorup and Dr. Adenokun. The goal of our literature review was to assess previously conducted studies that address our research question, which is, what is the impact of shift work on nurses' physical and psychological well-being? The population of the study was both male and female nurses that work both day shift and night shift or a rotating schedule of both. Some variables that were studied were day shift versus night shift, male and female, and prevalence of physical and psychological problems that may arise from shift work. The methods. Negative health effects of shift works are known but not well understood. Data was obtained from nurses through either an online or in-person survey in all three of our literatures that we reviewed. Qualitative and quantitative data findings were compiled for significant findings and trends among the participants. The Standard Shiftwork Index questionnaire and other standardized surveying methods were utilized to assess the variables of participant demographics, work environment, and general health status. Some results that were found. Females were more prone to sleep disturbances, fatigue, and poor psychological well-being. Nurses' injury increased with night shift workers. Night shift workers had lower job satisfaction. Night shift workers suffered from fatigue at a higher rate, and night shift workers experienced chronic fatigue. From one of our studies, RNS work can be a stressful factor with an impact on workers' health and well-being, in particular on job satisfaction, quality and quantity of sleep, and psychological cardiovascular conditions frequently inducing chronic fatigue. In conclusion,
The general consensus being that nursing is a demanding and stressful profession, often associated with physical and psychological distress, poor job satisfaction, poor sleep, and poor health. The findings suggest that the supervisor's support and task orientation may have a protective role in employee health. Interventions targeted at organizational climate may assist in mitigating the potential negative impacts of shift work schedules on employees' health. Further research that could be found. Research reviewed shows the importance of nurses maintaining personal health and wellness. The effects of shift work are well known to be detrimental to health, but more research is needed to understand the variability between shift workers' health status and interventions to mitigate the negative effects. These are our references that we use to conduct this study. Thank you for your time and have a good night.